The most unfortunate aspects of the opioid crisis in America is the myth that the only people who are affected by overdose deaths are individuals who are using street drugs. The truth, however, is that as many as 50% of all opioid-related deaths are due to prescription medications. Many times, these medications are being prescribed to patients as the result of injury, recent surgery, or to relieve the severe pain that can be associated with many forms of cancer. Practically all of us have experienced these types of medical conditions ourselves, or at the very least have a loved one who has. The purpose of this video is to inform the audience about how simple it can be to save the life of a friend, neighbor, family member, or colleague who is experiencing an opioid overdose.
So first off, we'll talk about what opioids are, and that is they're pain medicines used to treat severe pain, for acute severe pain. Some common examples of opioids are oxycodone, hydrocodone, codeine, and morphine. You may have heard of some of these. Now, if you take too much of these, you can cause an opioid overdose, which is, there's some signs and symptoms, including respiratory depression. What that means is a lower respiratory rate. Your breathing becomes very shallow and very infrequent. You need to watch out for this if you're taking too high of a dose. Nasal naloxone is the antidote for this. So if you've taken opioids, whether it be hydrocodone or oxycodone, and taken too much of this, nasal naloxone can be administered through the nasal passages to help reverse this. And how it works, it hits the receptor, that same receptor that these other opioids are hitting. So the same receptor that hydrocodone hits, nasal naloxone hits that same receptors and actually knocks off the hydrocodone from that receptor, therefore reversing the respiratory symptoms of it. So that's how it helps with overdose. Now, how can you get naloxone, nasal naloxone? You can get it from your local pharmacy with or without a prescription. With a prescription, your pharmacist can actually bill your insurance, and you can have as little as a $0 copay. Now, without a prescription, you'll have to pay full price, and that can range anywhere from $70 to $150, just depending. So please ask your local pharmacist for details on how to get it, and your local physician on a prescription if you would like it.
Hello, my name is Max Jabay. I am an EMT with Ashford Rescue Squad. I am also a second-year medical student at Alabama College of Osteopathic Medicine. Today I'm going to be talking about how to administer nasal naloxone. So the first thing that you're going to do is that if you see a patient who is unresponsive, you're going to go up to that patient, you're going to give a firm sternal rub. Then you will go, a lot of us have smartphones, and on the smartphone is a flashlight. So I will turn on my flashlight on my smartphone, or if I have a pen light, I'll use my pen light. I'm going to shine it in the eyes of the patient to see if the pupils are pinpoint. If the pupils are pinpoint, from there, then I know that I have an opiate overdose. I will then grab my nasal naloxone and I will administer it once into their nose. Upon administering it, I will immediately call 911. It is crucial to call 911 even if the patient does respond to the naloxone. Just because you have given the reversal agent does not mean that the drug is still in the system. Patients can re-overdose after giving nasal naloxone. Once the EMS or paramedics or fire come to scene, it's crucial that you tell them that you have delivered nasal naloxone to that patient.